With no further ado, I'm gonna hand the mic for our first presenter for tonight, my colleague Madiha Tariq from Access.
Thank you so much and welcome everyone. We can actually go to the next slide. So, I'm really excited to be, co-chairing this session of the symposium with Maha. What I'm going to talk about today is I'm going to talk to you guys a little bit about Access, which is where I work. I'm the public health director there, and also talk about some of the issues that impact our community, specifically when it comes to, how research impacts the health issues that that occur in our community. So next slide. So before I begin, I just want to kind of talk about Access. We celebrating our 50th birthday this year. So if you guys have not, if you don't have plans on Thursday, November 17th, come to our Access dinner. It's going to be at the Detroit Marriott downtown. For the last 50 years, I mean, actually, it's been 51 years because, last year was a time warp. But in 1971, a group of volunteers got together and they recognized that there's a huge population of folks coming in from the Middle East, North Africa region into Michigan, specifically in Southeast Michigan. And a lot of these folks did not have, they had language barriers, acculturation barriers, and were unable to understand or navigate the systems, social services, health services. So these volunteers created the storefront, and today Access is this huge organization. We have over 150 programs. Our staff has crossed the 400 number. So we're an enormous organization that is making an impact locally and globally. One of the things that I will say is very, very unique about Access is that we are truly grassroots. I know Dr. Thompson talks about the grass tips to the grassroots, and this picture that I have on the slide is a depiction of how grassroots we are. I was putting this slideshow together, and one of my staff members saw this picture, and they were like, "Oh my goodness, that's my mom in that picture in the white with the scarf on her head." And I was like, she's like, and this person is our community engagement manager now, and she, seeks services at Access. So really, it's a true organization that's for the people, by the people. Next slide. Okay, so I know yesterday we talked about terminology. I thought it'd be very important to kind of touch on some specific things about Arab Americans that are very important when we're talking about their health. Arab immigration into the U.S., Arab Chaldean most recently, but MENA immigration into the U.S. began in the 1880s. Actually, in the center of the slide, you'll see a picture from 1897 of the Zenia family that migrated from Syria. There's been many different waves of immigration into the U.S. for MENA communities. There was the brain drain. There was history with Henry Ford, right? Henry Ford came here, wanted to expand his workforce, and he started bringing people from primarily Christians from Syria, Iraq, Lebanon. And then, so that was the basic infrastructure. That's how, Dearborn became such a big center of the MENA community. Then there was the brain drain, a lot of people that came in for greater opportunities, higher education that happened in the 50s and 60s. And then in the 70s to the present time, a lot of the immigration has been, folks that, the most prominent in the media immigration has been folks that are fleeing from war. So I think it's really important to think about this because the health factors that impact these communities are not just your regular social determinants of health. Actually, my colleague, Dr. Hamami, talks about this. These kind of communities are impacted by the political determinants of health as well. A lot of them are coming from conflict, are coming from places where the government, betrayed them, lost their trust. So when we are serving these communities or we're doing research in these communities, we must think about that. We must think about the fact that there is trust building that needs to happen for us to be able to really penetrate into the community in an impactful way. The other piece also is, looking at the values that the community carries. So, a lot of folks, a lot of MENA communities in the US are, there's a lot of family-oriented, a lot of people have like interconnections here in Dearborn and all over the country. In Dearborn alone is one of the largest concentrations of Arab Americans in the US. So the cultural infrastructure that we carry here in Dearborn literally connects us to the MENA community all over this country and all over the world, actually. Next slide. Oh, actually, before you go to the next slide, I also want to, I shared a little link here, which I'm going to talk about it later. But, if you really want to look at the portrait of Arab Americans, we have done some work on this. So you can specifically look at what Arab Americans and Chaldean Americans, health factors are on a national level. So next slide. The one thing that I think uniquely impacts people from the MENA community in the US is data invisibility. So Arab Americans, Chaldean Americans are not considered a minority when it comes to federal agencies. They're considered white. And there's many factors to this. There is obviously, I love this slide because it's Rashida Tlaib spoke to Congress and she said, do I look white to you? This has been an ongoing issue. We've been working on it for 15 years now, trying to create a minority category within the census for the MENA community. But to this day, because of political reasons, we have not been able to push this through. We have a lot of hope because we are seeing some changes on the state level, which I'll talk about. And you're wondering right now, like, what does data invisible? What has that got to do with health issues? So let me tell you. Next slide. So I'm going to just leave a cliffhanger here because I know Dr. Dallo is going to be speaking next, and she's going to tell you what happened. But when first, the pandemic began, there was this false sense of security in the MENA community about COVID. Over and over again, we heard people say, oh, this is something that doesn't impact our community. And you think, like, why is that happening? Because if you look at the state dashboard, you'll see that the positivity rate for MENA community was like under 1% for most of the time of the pandemic. We had people like having weddings and like, working with wedding halls and telling them, okay, park the cars in the street so that the state doesn't catch us. What are they like overreacting to this pandemic thing? Because they just didn't know, like they didn't have the data, they didn't have the media coverage to know that this was an issue that impacted the community. So this is like actually one of the reports from, on a county level. And I know like there was many cases where there was like, you would look at the demographics and it would say Arab American, very low percentage. But then when you look at unknown ethnicity, huge amount of percentage of people that were positive. So what Dr. Dallo did is she actually disaggregated the data on the state level, and I will let her tell you what the actual positivity rate for COVID was when she's presenting. Next. So data invisibility, we know, is a huge issue. And that's why 3 years ago, we launched a program at Access called the Center for Arab Narratives. And the Center for Arab Narratives really, pushes for MENA category to be collected. We push for community scholarship. We push for community engagement and research, kind of similar to what the Symposium is doing. And one of the things, can go next slide. One of the things we did is we worked on, we brought scholars from all around the country that focus on the MENA category, that focus on identity research, and everybody, including folks from the US Census. And we pulled together these, created a standardized demographic collection tool that can be used, that we would like all researchers, all government bodies, all bodies that are collecting information to start using. And we created 3 options. By the way, this has been tested by the US Census with communities all over the country. So this is not just like us coming up with something, it's actually something that has been pilot tested with communities. So this is option 1. I don't know if people can see it, but I know that Chris is gonna share this information as an attachment. Can you go to the next slide? This is option 2. So like if, depending on how much detail or what the intake looks like, this is an option. And then if you can't put this extensive, piece of a body of demographic collection tool in your survey, we also have option 3, which is in the next slide. That's very simple. All you're doing is including MENA category in your existing demographic tool with a little bit of explanation on what MENA is. So you'll see, we'll share this with you, and I really hope that we're going to actually start using it, because we couldn't make the change from the top, but I think there's a lot of power in making the change from the bottom and letting it seep up to the top. Some of the other things CEnR has done, can we go to the next slide, please? And CEnR is Center for Arab Narratives. So some of the other things that we've done is we've actually worked with researchers to disaggregate data. Alex is going to put in the chat links to some of the reports we generated. And what we did is we looked at the data from the American Community Survey, and using a surname algorithm, which Wayne State actually owns. So there's actually an algorithm that this university owns that can help take out numbers of people who are from the Middle East, North Africa community based on their last name. It's really cool. So using that algorithm, we were able to disaggregate data on the MENA community to look at different factors that the American Community Survey collects. And some of the big findings from this was, Arab American community and Chaldean communities in Michigan have lower socioeconomic status compared to Arab American communities nationally. They have high level of education. A lot of people are actually U.S. citizens, which is really.
Oh yeah, let's do that.
We're doing, we're doing a lot of civic engagement, and
we got.
I just want to ask everyone to mute themselves, please.
Thank you so much. So we are, we're really like trying to look at the civic engagement and the power of that for this community. The other thing we've also done is we have used the Center for Arab Narrative platform to really look at, to really create some community empowered research, like things that we want to know. What is the national impact of Arab American giving? Something we can use to fight the negative political rhetoric that exists. And as a result of our work, next slide, please. Oh, sorry. And before I talk about that, I want to also say social media. So the one thing that I think always bothers me is we're a community-based organization. Researcher from a university comes to us and they're like, hey, can you have your people fill out this survey? We'll give them $25. It really bothers me when I think, I'm like, are these folks filling out the survey because they want to get the $25? Like, or do they understand the larger impact of this study? So it's like there's always been this disconnect that research is done and we are disseminating it in ways that the community doesn't understand. So we wanted to change this. And what we started doing is data visualization. And I'll give you a great example of this. A few years ago, I think it was 3-4 years ago, we did a study on reproductive coercion. And what we looked at was that in the MENA community, a lot of domestic violence cases, there was also reproductive coercion. And so a lot of women were unable to leave abusive relationships because they would get pregnant because there was reproductive coercion. So now, years later, Roe v. Wade is overturned, right? So what we did is Center for Arab Narratives, pulled out that data, and they said, you can look at this research and you can see that reproductive coercion is a factor, a risk factor for domestic violence. So a thing like overturn of Roe v. Wade can pull women in these cycles of domestic violence and poverty that they cannot get out of. And so it's like showing them how that research is relevant to what's happening in their lives every day. So that's kind of what we do now. We've been looking at a lot, anybody who's published with us recently, we are looking for ways to make it an attractive social media post so that the community who's watching it can understand what the research means. Next slide. Our work with the MENA category has also taken a lot of traction. So when in 2017, Congress was proposed a MENA category that was tested in the community to include into the US Census for 2020. 2017, Congress shut it down. They said, nope, no can do. So that's when we started working with the state, with the counties on the local level. And as we started working, and I know Dr. Hamami and I had probably talked about this in every single meeting with the state about including the MENA category. I think they just got sick of our harassment. And finally, we got this amazing leadership from the state to invest in including MENA category. Right now, the next BRFS survey that's conducted in the state is going to have a MENA category. On the national level, there's several federal orders that are happening that will include MENA as part of the race and equity efforts that are happening in federal departments. There is also, our MICR, which is the vaccine database, is going to include data on MENA communities. And this is extremely important because having federally be recognized as a minority impacts our ability to apply for example, NIH grants. I will tell you, we tried to apply for a CDC grant through the Office of Minority Health. And we literally on the phone with the program officer, and they were like, no, you can't apply because you're not a minority. You're not one of the categorized minorities that's in front of me. So this impacts funding. This impacts our ability to know what problem we are facing, understanding the aggregate story. And frankly, it helps engage people and understand why is it important when you're filling out that intake form to indicate that you're from the MENA community. Because this is like the last page of that Dr. Seuss Horton Hears a Who story, where all these tiny little people on a little, I don't know if you guys have heard the story, start screaming, we are here, we are here, we are here. And finally, somebody, a huge elephant hears them and protects them. So anyway, I don't know why I went to a Dr. Seuss rabbit hole here, but next slide, final slide. Sorry about that. I hope that you will all engage in research, no matter what your qualifications or degrees are. I hope that you will support the work that's been done on a community level. One of the great things that to join would be engaging in the Arab Health Summit. This is the only summit of its kind that presents and preserves research on health issues in Arab communities. The next one, I put the history about it, but the next one is going to be in 2024. So stay tuned. And I'm going to leave one slide as I leave, so you can you go to the next slide? This is how you can follow us so that you can see all those awesome data visualizations that we are doing. So whatever this thing is called, @Arab Narratives is the Instagram handle for Center for Arab Narratives. So please join us, join this online community. Let's make some noise together. I'm gonna stop there. Thank you.